Let me first give you an update on the latest data from the COBRA coronavirus data file. Through the government's ongoing monitoring and testing programme, as of today, 669,850 tests for coronavirus have now been carried out in the UK, including 29,058 tests carried out yesterday. 152,840 people have tested positive, and that's an increase of 4,463 cases since yesterday. 15,953 people are currently in hospital with the coronavirus in the UK, down from 16,411 on the 25th of April. And sadly, of those hospitalised with the virus, 20,732 have now died, and that is an increase of 413 fatalities since yesterday. And we express our deepest condolences to the families and friends of these victims. At the beginning of the outbreak of this virus, we saw significant problems in panic buying. That episode quickly subsided, and food availability now is back to normal levels and has been for several weeks. All supermarkets have introduced social distancing measures to protect both their staff and their customers, and it is essential that shoppers respect these measures. The food supply chain has also seen a significant reduction in staff absence over recent weeks, as staff who had been self-isolating through suspected coronavirus have returned to work. So absence levels are down from a peak of typically 20% in food businesses 3 weeks ago to less than 10% at the end of last week, and in some cases, individual companies reporting absences as low as 6%. We have put in place measures to support the clinically vulnerable. So far, 500,000 food parcels have been delivered to the shielded group, that is those who cannot leave home at all due to a clinical condition that they have. And in addition, the major supermarkets have agreed to prioritise delivery slots for those in this shielded group. And so far, over 300,000 such deliveries have been made, enabling people to shop normally and choose the goods that they want to buy. We recognise that there are others who are not clinically vulnerable and therefore not in that shielded group, but who may also be in need of help, perhaps through having a disability or another type of medical condition, or indeed being unable to draw on family and neighbours to help them. So we have been working with local authorities to ensure that those people can be allocated a volunteer shopper to help them get their food needs. And charities such as Age UK and others can now also make direct referrals on the Good Samaritan app to locate volunteers for those in need.